Many of the children that we work with during the preschool and early elementary years are susceptible for having difficulties in reading. Some evidence suggests that half of children with language impairment will struggle with reading. So that's a really serious problem, and it's one we need to be very attentive towards and vigilant about. Identifying children who are likely to struggle with reading development, and to introduce evidence-based approaches that can help put them on a more positive trajectory in their reading development. So the research is very clear that children who struggle with reading, their challenges in this area are present early in life. So, for instance, children who are poor comprehenders in the later primary grades in the area of reading, these are children who often have smaller vocabularies and less developed grammar skills in early childhood, as detectable at 24 months, 36 months, compared to children who are not going to be poor comprehenders. The SLP who takes this class is going to walk away with 3 new avenues for improving their clinical practice. Number one, and perhaps the most simplest takeaway, is they're going to be more knowledgeable about how vigilant we have to be to ensure that we're attending to literacy within our clinical practices. Too often, literacy is set aside and we're thinking about it as something separate than communication and language, but we need to really fold it into our focus. Second, in this course, I described some very simple avenues for screening children to determine when their literacy might not be developing. SLPs will walk away with some simple advice for how to screen for early literacy development to determine when children might be struggling in this area. And third, SLPs will walk away with some very simple but functional evidence-based tools they can use to improve children's emergent literacy skills in their clinical interventions.